Christian, when we go to the doctor, and one of the questions we always get asked is family history, and that certainly
Right.
comes into play when we talk about heart health as well. Doctors want to know if there's anything on either side of the family. How much does that play a role?
That's an important question, Scott. A great degree of cardiovascular disease is genetic. It's inherited. It's passed on from a great-grandparent to a grandparent to a parent to you and I, and unfortunately on to our children. So I want to say to you that for the first time in history, you may have inherited heart disease, but for the first time, it does not have to be your destiny. There are ways, and I talk about them in the book. Certain blood tests that you normally wouldn't get can interpret and indicate whether you have a propensity for some of those in your family line. And then you must